Good afternoon, dear members of the jury and participants of this conference. My name is Diana Titova. I'm a student of Medical Faculty of Saratov State Medical University. I would like to tell you about an academic supervisor of the thoracic oncology at the Petrov Center Diagnostic. His name is Eugenie Levchenko. It's a doctor with more than 20 years of practice. He has on medicine methods and huge experience on their positive application. The doctor is always fighting for lives his patients with cancer even if it seems they are hopeless. The talented surgeon performs the most difficult operations, and it's really impressive. Today he has achieved particular success in the conducting of isolated chemoperfusions. This is a unique intervention because when the operated lung is disconnected from a circulatory system, all life support of the body provided by the functioning of another lung during the operation. Levchenko developed this technique in 2006. The number of operations with its application is approaching 200. Every second patient is completely cured according to all oncological criteria from the fourth stage of cancer. Levchenko performed the operation to remove 70 metastases in a 17-year-old patient with osteosarcoma in 2009. So, what is this unique method? Let's talk about it more details. First of all, metastases are removed by using the method of isolated chemoperfusion. But even if doctors can get rid of all detected lesions, new ones subsequently arise in from 50 to 80% of cases. If there are microchanges in the organ which doctors couldn't find by filling and using computed tomography, conditions are formed when this undiagnosed metastasis cannot survive. An extremely high dose of chemotherapy is injected into the lung, which is still disconnected from the general blood flow. Besides, doctors increase an oxygen content with using an oxygenator. It has a destructive effect on cancer cells. The lung is perfused for half an hour. After this time, the content of medication dropped sharply. Then the lung is washed from the medicine and given back to the body. Doctors found 42 metastases in girls' one lung only on the operating table, but they were around from 10 to 15 on computed tomography. And it's not the limit, because Levchenko had an operation performed on a 22-year-old man with 104 metastases in his practice. Also, Eugenie Levchenko has 12 patents. It's not including developed, tested, and not yet patent techniques. He often performs demonstration operations on the road, but this technique is very complex both in surgery and reproduction. Doctors must have experience in thoracic and vascular surgery for their performance. People get a chance on their new healthy life without cancer, thanks to the efforts of this genius oncologist, and it deserves respect. That's all. Thanks for your attention.